I'm Martin Murchie, I'm Chief Officer for Data and Insights for the City Council. So no doubt, data very much part of the zeitgeist. I'll just remind you quickly of what the promise says about data. I may have gone too far. Maybe I should let Val control my slides. There we go, the promise. So this is from the plan 21 to 24. Scotland will have a cohesive centre picture of all data on the processes and systems that impact on children and their families. Data picture will have been used to fully align data systems, collection and analysis methodologies to what matters to children and families and the needs of those who take decisions. We'll come back to that bit about decision making. And this is what is in the National Care Service Bill. They're committing to creation of a nationally consistent, integrated and accessible electronic social care and health record. So part of the zeitgeist clearly, and then we could go back to COVID and all the work that was underpinned by data there. We could talk about cost of living coming up and how important that is. We could talk about drugs death task force, completely infused with data issues, whether that's collection of data, analysis of data, data sharing stuff. So my face tends to make funny shapes when I read these statements, particularly the promise and the National Care Service commitment. Absolutely the right things to be aiming for, but easier to say than deliver, I think. So we'll see how those are implemented in the coming years. So I've discovered something from being in this job, and it's that this could be any gathering of any professionals talking about any problem, and fundamentally underpinning everything would be data and information, because it comes down to what we know and what we don't know and what we do with that knowledge. And in there somewhere, there's even epistemological questions about how we know things. So it infuses everything that we do. So there's a lot that I could say about data today. So I could have showed you something like this, which is describing a data pipeline along with the various tools that we can use to move from data sources through to usable information and insight. And if you check the top of that slide, you'll see that there's a correlation between that and the top part of the slide that Steve just showed you, but I'm not going to show you that. I thought you probably would have geeked out enough from Steve's presentation. So I'm going to talk more broadly and really start at the other end. So just referencing like that movie that came out a few months ago, I've started to think of data as everything, everywhere, all at once. Which I was at Tech on Sunday to see Brian Cox, so I do realise that I'm in danger of sounding a bit like him on this, which probably isn't that helpful. So I just want to get a bit more specific in terms of what that all means when we're talking about public protection and specifically early intervention and prevention. So firstly, like pretty much everything we deal with, and I've certainly had an insight into that in the two breakouts that we had, it's complex. So we need to know things at different levels, and this by no means is all the levels, but it's some of the key ones. We need to know things about our different communities. We need to know about the services we provide, and we need to know things about the people as individuals that we're all here to protect. So looking at that slide, for communities, we need to understand demographics and geographics, which elements within which communities are likely to be more at risk and how. We need to know how groups experience harm, and we need to know changes over time. And why do we need to know that? So we can take policy decisions, so we can allocate resources, so we can seek and give assurance about impacts at that community level. Just moving down, we also need to understand our own services. What services do we provide? How effective are they? What's the level of demand and capacity? What's the cost? And why do we need to know that? So we can make decisions about the nature and level of future services. What might we need to do more of or do less of? Do we need to do things differently? How to redesign services? And then when we bring that down to the bottom there, the individual level, I mean, what do we potentially need to know if we're going to respond to their needs, but also to prevent future harm? Well, obviously, we need a lot of personal data and identifiers, including things around, for example, protected characteristics, and then information about immediately assessed needs, but maybe also information about their family or wider social circle, or about physical or mental health issues. Maybe not just where they live, but their housing situation, maybe information on financial inclusion, financial exclusion, and definitely information about certain events that happen in their lives. So all of this, if you just list it like I've done at those 3 levels, can sound a bit overwhelming. So just, Angela said I'll be talking about what we're doing in the family support model. So I'll just describe briefly how we're approaching that through the family support model work. So at the community level, I think we are in reasonable shape. More for us to do, absolutely, but this level gets a lot of focus from government because it's this level of data that they need to make policy decisions to form the basis of legislation and to get assurance from us about the delivery of those services. But that's not necessarily the case with our specific services here locally or with individuals. So that's where we're putting our focus through the family support model work. So firstly, on our services, just to state again, what we're trying to do is support good decision making about service design, service commissioning, and the provision of services. So at this level, we more or less know who the decision makers are in terms of that design of services, the commissioning of services, and what decisions they're required to make. And from that, what sort of data and information they need to make informed decisions. Through the various work groups and events we had through Family Support Model, we self-diagnosed that we need to better understand what we commission and deliver and how those services fit together. We said we needed to understand the impact of universal services on Tier 2 early intervention and prevention services and vice versa. And also how both of those impact on specialist services. Also to understand where there are potential overlaps of services, where there's potential gaps, which services have the most impact and outcomes, and which are most cost effective, and so on. So this is what we've started to try and do through the family support model. Like first rule of data management, make a list and then make a table. So list all the services. This is what we're doing. Categorize them in terms of type of service, sector, GERFIC tier. Identify demand and throughput for the services. Identify cost. Identify the commissioning body and the referral routes. So you see from what I've put up in that slide that we have made progress, but it's pretty slow progress, which is why I deliberately used the words start and try at the beginning of that sentence. But once we have enough of this complete, we can do the analysis, which is going to help inform decision making about those services. And we're beginning that, but we don't yet have enough data. You'll see that big blue box there right in the middle says blank, and that's what we're hoping to complete with our big list of services as we engage with people to understand a bit more about them. So when we get into the individual level, back to that, it's the same principles, but we, or certainly I'm, much less clear on who the decision makers are, what decisions they're required to make, and what information and data they need to do that. So that's been our starting point through the family support model work here. We're working with colleagues to identify the who, for example, lead professionals or named persons, and from there, what decisions they make and what information and data those decisions are now based on. Then, of course, there's a follow-up to that. What information and data would support more informed decisions? How do we improve that? So again, that's what we're starting to do in part through working with colleagues on case studies. And I was struck when I was in the breakouts that we had, that there were kind of the same conversations I'd be wanting to have at this stage, where we're trying to understand who's making decisions, or based on what data, how those are designed to prevent and implement and have early intervention on services. And I was kind of just wanting to sit there and go, right, let's take that to the next stage. What is it that we need to do, and how does that impact on the data that we can get and bring together? So when we bring all of that down to the very specific things that I think we need at that individual level, we can then respond to that from a data perspective, and respond more and more effectively as we develop the foundational elements of the data ecosystem across our partners. And so Steve's presentation was full of examples of that. But I could add in common data standards, interoperability of data across services, but across different organizations as well, the easier sharing of data, the accessible data platforms, and I think, as important, embedding data and data management principles deeper into our culture and our skills. So that's me galloping through our approach to how we're engaging with colleagues and different organizations through the family support model. If I've got time, just want to throw in a couple of things that are sometimes misunderstood, I think, when I talk about data. And first, that it's about machines and numbers and automation of decisions. Well, it is obviously partly about machines and numbers, but at all levels here, I've talked about people making decisions, and that's what this is about. It's data and information, quantitative and qualitative, supporting decision making that are made by people. I totally understand that when we're dealing with people and complexity and scarce time and scarce resources, we're not going to become purely empirical in our decision making. And in the real world, the best and only course sometimes is combining what we learn from data with what we intuitively know and believe as professionals. The second point is a really important one, a view that we won't be able to do what we need because of information and governance and data protection restrictions. Well, it is absolutely true that there are checks on what our organizations can and should do with people's data, but that doesn't mean we can't do things. When we're dealing with personal data, and when we're trying to move from reaction, where a harm is clear and evident, to prevention, where it becomes less clear, that we absolutely need to be really thoughtful about that. But the things that I would keep emphasizing is, we need to be clear about our purpose if we're talking about sharing information. We need to be proportionate in the way that we do that and share the information. We need to balance all of that with risks, and that's a key point in all of this. There are risks of sharing data, but equally there are potentially massive risks, as we've talked about throughout this today, about not sharing data. And the last one is we need to be transparent about that. So we need to be clear what we're doing and transparent with everyone. So just to conclude, I had 15 minutes penciled in for data. I could have shown you some shiny things, or data models and data platforms. I could have talked about developments nationally or locally that I'm around in terms of data standards, unique identifiers, or the data strategy that's being developed around health and social care nationally, and a bunch of other things as well. But I think Steve covered some of those things, some of the technicalities of data and that data maturity curve. So I wanted my message to be that becoming more data driven is not something that's going to be done to the system by techie people like Steve or data people like me. It has to be something that's done by the system with techie and data people. That's going to involve focus and sustained work. And I was aiming for something of a call to arms to professional leaders like yourselves, but right through the system, to focus on the decisions we're making, how those are underpinned by data and information, how we can improve that, particularly as we shift more upstream towards that prevention agenda.